This video presents challenges to engage cardiac diseased older adults with new technological devices in the medical spectrum. It focuses on telemedicine to deal with the barriers that these adults may contend. Telemedicine is the use of telecommunication technology for medical diagnostics, monitoring, and therapeutic purposes when distance separates these participants. The potential benefits of telehealth include increased accessibility to care, productivity gains for health providers and patients through reduced travel, potential for cost savings, and an opportunity to develop culturally appropriate services that are more sensitive to the needs of special populations. Health has been hindered at times by telemedicine systems. Telemedicine systems use a variety of technology to accomplish this monitoring while reducing the need for face-to-face visits with clinicians that may be inconvenient and costly for the patients and their families. For example, some technologies allow patients to directly upload monitoring data to the healthcare system, whereby it can be made available to several clinicians on the patient's healthcare team. Others make use of higher bandwidth telephone or cable television infrastructures to apply two-way interactive video, audio, and medical diagnostic instrumentation. The close monitoring afforded by these approaches may allow better healthcare through early detection of problems or more precise dosing of medications and biologic agents, potentially reducing costs. These types of systems also support self-determination and empowerment of patients that can also enhance clinician-patient collaboration. In spite of the considerable advantages of the use of telecommunication for people with cardiovascular diseases, studies present common recurrent barriers that should be concerned around the adoption of new technology devices. The services in the medical spectrum in particular and in general spectrum at all. Although older adults are less inclined than other age groups to say they like trying new technology, some seniors do show a strong preference for early tech adoption. The recurrent barriers include physical limitations, lack of motivation, or confidence to use new devices in relation to the older medical means, and even skepticism of the results and dependency on peer assistance to practically activate the technological devices. Cardiovascular diseased older adults should face potential barriers included or barriers that are not directly connected to the activation of the technological devices, but are necessary to use them properly. Most notably, current medical health cardiac medication platforms and general lack of socialization with the patients, which means peer support inherent, as Bastrom et al. Mentioned in the study. Most notably, current medical health cardiac rehabilitation platforms generally lack the socialization with other patients, which means peer support inherent to facility-based cardiac rehabilitation. This socialization, while difficult to quantify, may help to address the loneliness commonly experienced by older patients with cardiac rehabilitation disease. It's mentioned that despite some of these unique challenges facing the older adult population, When it comes to technology, most seniors who become internet users make visits to the digital world a regular occurrence. For these evidences, it can be agreed that the importance of telemedicine to older adults is crucial to their cardiovascular healthcare to get a better life and stronger heart and better wellness and lifestyle.